Hello everyone. Multiple visit protocols have been commonly used technique in regenerative endodontic procedures, which involve placement of intracanal medicament between visits, which may have some difficulties in removing of those medicaments and also the tooth discoloration. A single visit approach could resolve those difficulties and also decrease the chance of intraoperative bacterial contaminations and might be suitable for uncooperative patients. And since there are no enough clinical studies to support the superiority of single visit protocols over the multiple visit approach, therefore, this preliminary randomized clinical trial done by Egyptian group from Cairo University, published in Israeli Endodontic Journal, aimed to compare the clinical and radiographical outcome, post-operative sensitivity, and incidence of tooth discoloration following single visit versus two visit regenerative procedures in non-vital mature anterior teeth. It's a prospective better randomized clinical trial including of 32 medically free patients aged between 15 to 35 with necrotic pulp, mature anterior teeth with preapical lesion measured between 2 to 5 millimeters. Patients were excluded if they were medically compromised, pregnant females, or showing a fistula or swelling, or in cases of non-restorable tooth, showing fracture, ankylosing, or resorption. Preoperative measurement was taken by the CBCT as a baseline, as well as the tooth shade. After the tooth was anesthetized with 2% mepivacaine with epinephrine, canal were instrumented using protaper next rotary files and irrigated with 2.5% of sodium hypochlorite. And each case was assigned to one of two groups according to the treatment protocols of 16 participants each group, either to single visit or two visit, where in the two visit, calcium hydroxide was placed as intracanal medicament for 3 weeks. Both groups had induced the apical bleeding, and PRF clot was placed as a scaffold and followed by biodentin as a cervical barrier and then sealed with resin composite. The primary outcome assessment were the clinical and radiographical healing of periapical lesion, and the secondary outcome were regain of sensitivity and incidence of discolorations. The finding of this paper showed out of 32 patients were enrolled, 28 patients were followed up over 1 year with a recall rate of 87%. Even though there was no statistical significant difference between the two approaches, the overall success rate of single visit approach were only 28%, which is 4 cases, while 64% of the two visit approach, which is the double of the cases. And none of the cases with the single visit approach did regain the sensitivity, while 2 cases in the two visit approaches. And regarding the incidence of tooth discoloration, only 1 case in single visit approach showed discoloration. As a conclusion, although this study showed no statistical significant difference between two groups, there is a high failure rate of 57% with a single visit approach, which raises our concern. Is it because of deeply bacterial penetration, which require more times for those bacteria to be removed, or the need of using of activation method to compensate the use of intracanal medicament? Or it could be due to the reason of pulp necrosis, where notice in this study 5 of the failed cases had pulp necrosis due to the trauma. From this study, we can appreciate that regenerative endodontic procedure, it is a promising treatment approach for mature non-vital teeth. However, further investigation are needed for the single visit protocols. Thank you.